영어로 인터뷰해야지 돼서.
우와.
안녕하세요. 네, 오늘 정말 또 새로운 도전을 하게 되는데요. 피부과 교수님들 중에서도 여드름과 주사에 굉장히 유명하신 캐나다의 제일텐 교수님을 모시고 오늘 인터뷰를 하게 되었습니다. 근데 영어로 그거를 하게 돼서 일요일 아침인데 너무 긴장돼서 지금 5시인데 이렇게 아직까지도 긴장하고 있습니다. 그래서 오늘 제가 그 제일텐 교수님과 여러 가지 얘기를 나누고 여드름과 주사 피부에서 도움이 될 만한 꿀팁들 많이 정보 얻고 알려드리고자 합니다. 재밌게 봐주세요.
네. 마지막으로 대본을 읽어보겠습니다.
Hello, my name is Ha-eun Lee, and I'm working at Forest Dermatology Clinic in Seoul. Hello, my name is Ha-eun Lee, board certified dermatologist for 13 years, and I'm working at Forest Dermatology Clinic in Seoul. I'm honored to have the opportunity to interview world-class dermatologist Professor Jerry Tan. As a dermatologist, I'm grateful to read your academic articles and receive a lot of help. So I'm especially honored to be here today. I believe today's time will be helpful for many dermatologists, including myself, and this interview will be broadcasted on YouTube channel as well, so it will be helpful to all the subscribers. Now let me start the interview with Professor Tan.
It's a pleasure to be here. Thank you very much.
Thank you. 알쓸피식. I have a question regarding skincare recommendation for acne patients. Are there specific ingredients or skincare routine you typically recommend for acne patients?
So the skincare routine I typically recommend depends on whether I'm using the skincare as a treatment mitigator or an adjunctive to treatment itself. Now, let me explain why I break that up into two parts. For example, if we use a product that's very drying and irritating, oral isotretinoin, what you want with your cleanser is very soothing, very gentle, along with your moisturizer, along with your sunscreen. Almost like everything we said about the rosacea skincare. Whereas if you're using it as an adjunctive to improve acne as part of its treatment, then you have more active ingredients. So you might be looking at salicylic acid in your cleanser, you might be looking at glycolic acid in your cleanser. Your moisturizer or your serum may have lipohydroxy acid, you might have salicylic acid, you might have a tocoretinoid. So, but I think you have to have a very clear approach. Are you trying to mitigate potential side effects, or are you trying to enhance the efficacy in improving acne?
Sunscreen is crucial for acne-prone individuals, but when skin trouble persists, is there any alternative recommendation for them?
You see, one of the issues with sunscreens is that when sunscreens trigger, and this happens quite a bit, the patient will say to you, oh, I can't use the sunscreen, it makes my acne worse. The likelihood is it's not triggering their acne, it's actually leading to folliculitis, okay? And the thing about folliculitis is when you occlude the pores, why does that happen with some of these products that are called non-comedogenic? It happens because when you block pores in the presence of humidity or in the presence of hair conditioners or dampness, then you get two possible issues. One is going to be folliculitis by itself with either yeast or bacteria. The other one is going to be occlusion of sweat glands, which is miliaria. So in a very hot, humid summertime environment, let's say in Seoul, and people are damp and sweaty, plus they have longer hair, they have, maybe they use hairspray, plus they have conditioner in their hair, and it's all blocking those pores. Then what will happen is it'll block both your sweat glands which leads to miliaria. And then it will also potentially block your oil glands, which leads to folliculitis. But people don't know the difference, so they call it acne, right? And I think that's why many of the things that we recommend for acne are actually a little misguided, because it's everything that looks like a pimple is not acne.
We use topical retinoid for acne patients. Could you please provide some tips to reduce the irritation by topical retinoid?
The easiest way to think about reducing potential for irritation, in fact, there are two issues. One is irritation, and the way patients report irritation is, oh, doctor, it stings or it burns, and then it also looks red. Okay, so those are proxies for inflammation. On the other hand, skin barrier damage is usually reported by dryness or scaling. So those are the two possible issues that can come along with the use of topical retinoids. So the way you avoid it is to go low, go slow. Okay? If you prescribe, for example, a fairly potent retinoid, you don't have to push it hard. You can gently work it into the patient's program. So, for example, usually when I start a topical retinoid for a patient who's never used one before, or if I start a topical retinoid for a patient who's on oral isotretinoin, which I do because there are advantages to helping patients in that situation beyond oral isotretinoin. The way I tell them to use it is use it when you're awake and rinse it off before you go to sleep, and just twice a week. So for example, they would apply it after dinner, and then before they go to sleep, they would rinse it off, and they would apply moisturizer. And they do that 2 for 2, okay? Twice a week for 2 weeks. So make it really easy for people to remember, and then if they're fine with that, after that 2 weeks, they can go 4 times a week, and then 6 times a week, and then eventually they can leave it on overnight. But anytime they get too dry or too irritated, just reduce it. And reducing frequency of application reduces inflammation. And encouraging and recommending specific gentle cleansers and moisturizers reduces dryness and scaling. So that's how I would encourage patients to start.
Wow, very good tip. Thank you.
By the way, I'll tell you the reason I do that is because we did a trial that showed that that was the way that you should think about doing it. Because before we did that research study, I would do short contact in every patient. But what the study showed us was that it was in less frequent application, that is every other night, that improved the risk of irritation.
Thank you. Recently, we use trifluoroctane cream usually. So I'm curious if you have any clinical result suggesting that trifluoroctane cream is also helpful to preventing scarring?
Well, that's a terrific question. So trifluoroctane, I've been involved with before it was even called trifluoroctane. Many years ago, almost 8 to 10 years ago, it was called CD5789. And at that time, it was a retinoid that was being evaluated by Galderma to see if it could be a new product in the treatment for acne. So CD5789 was one of those treatments that came after adapalene. The adapalene is a 3rd generation topical retinoid. This one, trifluoroctane, is 4th generation. And the interesting thing about a 4th generation is that it's very selective against certain receptors in the skin, and much more so than the 3rd generations. The value to this product is that we were then able to do research studies to see how it would help reduce scars. Trifluoroctane came after adapalene. And with adapalene, we did a study called OSCAR, which was to evaluate on a half face whether, compared to its vehicle, it could actually not just improve acne, but also reduce the risk of scarring. And it did. So when trifluoroctane became available and approved for treating acne, the same type of trial was done, and it showed the same type of improvement in reducing scarring. Now, you might say to me, why would you use one versus the other? quite frankly, if you feel the way Trifertine feels on your skin, it's got a beautiful vehicle. It's very, very soft and it spreads very nicely. So the advance with this particular product called Aclef is that the advance is not just in the retinoid, 4th generation, but it's also in the vehicle formula. So the formula is actually more spreadable and it feels much nicer in terms of the elegance of the skin feel itself. So I think there are lots of advantages to the 4th generation, and thankfully it's shown not just improvement in acne, but also in the skin quality, especially in reducing the risk of acne scarring.
Thank you so much your time and expertise.
Oh, it's my pleasure.
I'm sure this interview will help a lot of doctors and subscribers who are watching this video clips. I hope you have a great stay in Seoul. Okay. Thank you again
It's
for
my
your
pleasure.
time.
Thank you so much.